what are my tips for birthing twins? Firstly, conversations with your midwife and your obstetric doctor in pregnancy. Find out what their local guidelines and guidance is regarding what labour and birth will look like with twins. Some units will recommend epidurals from the onset of labour. Some will recommend birthing in theatre, for example. The majority of units will recommend continuous monitoring for your baby heart rate trace wise, and the majority of them will recommend a fetal scalp electrode, which is the device that goes just underneath baby's skin on twin 1 and an ultrasound probe on twin 2 to be able to continuously monitor baby's heart rates in labour and birth because of the increased risks to twins during labour and birth. As I always say, benefits, risks, alternatives, ask all these questions ahead of time because they will really help you out and really help guide as well all your decision making. You can say no to anything that you want to, and it's taking on board what's happened in your past medical history or past obstetric history or current pregnancy, for example. Are there any other complications, for example, that have appeared that may influence your choices? You'll also be offered a caesarean birth should you choose to. This may depend on what positions your babies are in, whether they're head down, bum first, transverse, lying across you. Maybe there's been some growth concerns or some twin-to-twin transfusion, for example, concerns. It's having an awareness of everything that's gone on within that pregnancy. There's a higher chance of premature birth as well, which also may influence your decision making around labour and birth. If you can have those conversations ahead of time, you'll be able to think about where you want to have your babies, how you want to have your babies. You may even consider things like a doula. I'd highly recommend a birth preparation course. And when women and people are having twins, triplets or more, I always signpost them to the Twins Trust, who can really help guide and support them. Go along to an antenatal class. The Twins Trust sometimes have groups up and down the country that you can meet other mums who have had twins, triplets, etc. And that will really help provide your support system and your support network in that postnatal period, but also provide you with some really good practical advice and hands-on during pregnancy, and also some guidance for labour and birth too. Please also discuss any of your concerns, any of your questions with your community midwife, who will be able to help guide you as well.